Urinary health in women is a very complex subject. I see many women who, as they've gotten older, they've developed, bothersome urinary concerns. And many times that's not the reason they're there to see me. It's, for other things, kidney stones or other concerns. And many people just have not realized that these bothersome things that they're experiencing are actually medical problems that can be fixed. And they just suffer in silence. So a very important thing is just to be aware that when you start having, leakage concerns, or the frequency of urination has increased so much that you're not able to have a normal life, you're not able to do the things that you enjoy because you're worried about where the bathroom is. Those are things that we really need to address, and things that can be fixed. Pregnancy does special things to the human body, I would say. Yes, you get a beautiful child, but many times, everything else around can become a bit weaker, and there can be some damage to the areas there, which can certainly increase your risk of having urinary difficulties as you get older. So especially things like stress urinary incontinence, which is leaking when you cough or sneeze, or having prolapse of the bladder, which can present with symptoms of urinary frequency and urgency, and even pelvic pain. Urinary tract infections are extremely common. They're probably the most common reason that women present not only to the urologist, but maybe even just to their primary care doctor. They become an issue, and you need to see a urologist when they are coming too frequently. You're having an infection every few months. That's certainly not normal. You need to be evaluated. Or if they're coming with more concerning symptoms, so high fevers, kidney infections, for example, flank pain, nausea, vomiting. If you have to be admitted to the hospital, obviously that's a severe infection. You should probably see a urologist. You don't need a urologist to get started with prevention. Things that you can do at home. Make sure you're hydrating well. You want to drink enough water to flush all those bad bacteria out of your system. You want to have a good bladder program, which means you're not holding the urine for hours and hours. Sometimes you get busy, you hold your urine longer than you should. Try to go when you feel like you have an urge, right? When your bladder is telling you that it needs to go, it needs to go. Just go and empty your bladder. Cranberry juice is a very common, I guess you could say old wives' tale, that it helps preventing infections. I certainly support cranberry juice. It does have, there is a grain of truth in the whole cranberry juice theory. It does help prevent certain infections. As long as you don't overdo it, I won't add the vodka part. We'll leave that part out.